respirations, what should you do first?
Make sure
Make
the horse
out.
is under control.
Right. So, I'll read you the answers, you tell me what the better answer is. Perform a head tilt chin lift, place an OPA, perform drug assisted intubation, or administer oxygen by cannula.
Open air
Right
OPA.
position, I don't like any of that. I'd jump
Perform
first.
a head
Yeah.
tilt chin lift.
Yeah.
You
But
think
she-
that's the right
Why
answer?
not
Yeah.
jump
It doesn't feel like it because she
you don't
fell off
wanna-
and hit her
Alright,
head.
so what's the next best answer?
OPA?
Put the OPA in, right? Think like
That pulls the tongue out.
basic. I need to open the airway, I need to make sure it stays open, right?
That's true.
Okay.
So why would it not be the?
You don't want a head tilt chin lift,
A trauma.
trauma.
The answer
was
yeah,
straight.
yeah,
I
yeah.
always
Should've been
forget
dropped
that
first.
We want to put an adjunct in the airway.
That's what we want to do for that one.
Alright, so upon examining a 43-year-old male, you note unequal breath sounds. What is a sign or symptom of a simple pneumothorax? Is it shortness of breath with low pulse ox and JVD, or shortness of breath with decreased lung sounds on the affected side?
Second one.
Cool. An adult patient was involved in a motorcycle accident. Why should you remove his or her helmet? What would be a good reason to do that?
Examine the back of the head.
To manage the airway. An anxious 54-year-old female complains of chest pain. She hit the steering wheel after a car crash at highway speeds. Her sternum is red and tender. What's the answer?
Cardiac
contusion.
Cardiac contusion.
Yeah.
A 46-year-old male is trapped in his vehicle after a high-speed front-end collision. He is slow to respond to questions. You know, blood pooling in his seat. His vitals are pulse 130, respiratory rate of 8. How should you remove this patient from the vehicle?
Careful. Very careful.
Should you do it rapidly?
No.
That's the right answer. You should do it rapidly because he's not breathing. Rapidly extricate the patient. So there's blood in his seat, pulse of 130, and his respiratory rate is 8, so it needs to be rapidly extricated. So the other options are immobilize using a vest-type device, so you're like, I even forget what those are called, KD. Extricate the patient onto a long backboard, and or ask the patient to climb out of the vehicle window.
There we go.
Yeah.
And then the last one would be rapidly extricate the patient. Alright, a 26-year-old male is supine on the ground. He was assaulted and has obvious head and facial trauma. He has snoring respirations at a rate of 8. What should you do? What did you want to do?
Airway.
So the answer is assist ventilations via BVM, suction the airway, perform a head tilt chin lift, or perform a modified jaw thrust. What's the first step?
Drop the thing there.
Do the jaw thrust, right? Where you open it and then you can suction it. We don't do chin lifts, and you need to open it before you can bag it, right?
I know.
I know, this one's like.
So there. That's why we do this. Because it goes kind of rough, especially if you don't read it. If you don't read the book.
They throw that in there. That's fine.
A 44-year-old male was involved in a motor vehicle crash. He sustained severe blunt trauma to his chest and has deformity to the right femur. Multiple IV attempts were unsuccessful. Vital signs are BP 70/40, pulse 126, respiratory rate of 28. What should you do? Apply a traction splint, place the patient in a reverse Trendelenburg, establish IO, or apply a pulse oximeter. IO, good. Which of the following is true when log rolling a patient? One of them. Only 2 providers are recommended. The provider controlling the patient's hips are in charge. The provider maintaining SMR is in charge. The patient should assist you in rolling to his or her side.
SMR.
20-year-old male
Yeah, what
was
is SMR?
spinal
Spinal
cord
cord
restriction.
Okay.
A 28-year-old male was ejected during a car crash. He is unconscious and has no obvious bleeding. His vitals are BP 70/40, pulse 120, respiratory rate 22. What type of shock would you suspect? Anaphylactic, hemorrhagic, neurogenic, cardiogenic. 70/40, pulse of 120.
Hemorrhagic.
What would make it neurogenic?
If his heartbeat was like 55.
80, yeah, normal or low, right? A 10-year-old male fell from his bicycle and sustained abrasions to his left leg and left arm. He is alert and oriented. What should you do first? Initiate IV access and administer a 250 bolus. Secure the patient to a backboard, apply tourniquets, complete a primary and secondary assessment.
Assessment.
A 3-year-old female was involved in a car crash with 2 feet of intrusion into the passenger compartment. She is crying and has obvious deformity to the right humerus. Her car seat has a crack on the side of impact. What should you suspect? Significant injury has been distributed to the patient. Utilization of traction splint will be necessary. The biggest concern will be growth plate injury, or treatment will require rapid management of pain prior to transport.
So it's the first
And
one?
significant injury has been distributed. What a dumb question.
Yeah.
2 feet of, Jesus.
Yes, a lot.
Yeah. Yeah.
A 42-year-old female has been pulled from a smoke-filled apartment. Her mouth and nose are covered in soot. She has a weak, hoarse cry. Not like, but like, with inspiratory stridor, what should you do?
Tube.
Take that away.
Take that airway.
So, attempt a surgical crike, prepare for hypotensive shock, prepare for a difficult tube, or administer an albuterol via nebulizer. Prepare for a difficult tube. A 32-year-old male was ejected from a motor vehicle. He is unconscious with agonal respirations. Upon assessment, you note a dilated right pupil. What is the best device to secure the airway? Endotracheal tube. 26-year-old female was the unrestrained driver in a head-on collision. Her GCS is 4. Vital signs are 156/78, pulse is 66, respirations 12 and irregular. Her pupils are unequal. What should you do? Maintain a blood pressure of 140/90. Place the patient in a Trendelenburg position. Assist ventilations or establish an IV. A 50-year-old male fell from the 6-story balcony. Innovations attempt have been unsuccessful. His GCS is 6. You note agonal respirations. What should you do first? This question sucks. Provide oxygen via non-rebreather. Continue endotracheal intubation attempts. Perform a crike. Insert a supraglottic airway device. Oh, nice. Good. That's. A 33-year-old female has a GCS of 3 after being ejected from a motor vehicle. How should you prepare to intubate? Place the patient in a sniffing position and attempt direct intubation. Keep the patient in the C collar and place in a sniffing position. Maintain spinal precautions and use a video scope. Hyper-reflex the patient in the C collar and attempt direct laryngoscopy.
Video.
Maintain the spinal precautions and use a video. 29-year-old male falls 17 feet on the ground from a tree. He complains of pain with movement and pain on the right side of his chest when he breathes. You note accessory muscle use, focal tenderness, bony crepitus, and absent breath sounds on the right side. What should you suspect? Open pneumo, flailed chest, tear of the aortic arch, or a simple pneumothorax. Simple. 22-year-old male was involved in a car crash and hit a tree head on. The patient is on the ground outside the vehicle and is unconscious. His forearm is avulsed and you note a large pool of blood with active bleeding. His breathing is deep and labored. What should you do? Open the airway, perform a primary survey, apply a tourniquet, or listen to breath sounds. Tourniquet. Another fun question. Why wouldn't you? Don't you need to do a primary survey to
To
determine if you need to put
determine,
the-
yeah.
A 27-year-old female has multi-system trauma. Which life threat is your first priority? A perceived tension pneumo, penetrating injury to abdomen, significant external hemorrhage, or penetrating injury to the chest?
Hemorrhage.
13-year-old male was riding an all-terrain vehicle when he drove into a wire fence. He's sitting on the ground with a towel over his face. He has an open jaw fracture. What is your primary concern? Internal hemorrhage, obtaining parental consent, cervical spine injury, or an obstruction of the airway. That. A 41-year-old male was stabbed in the chest immediately below the sternum. He complains of shortness of breath and has engorged jugular veins. His vitals are BP 108 over 84. Noted. Yeah, that's the
Yeah.
answer. Pulse 130. So 108 over 84 is really narrow, right?
Yeah.
A 47-year-old female was stabbed with a knife in her right upper quadrant. Her GCS is 9. Vitals BP 78 over 50, pulse of 130. Respirations are 26. What should you do? Initiate IV on scene, administer 20 mils per kilo, pack the abdominal wound to control the bleeding, initiate IV access on scene, administer 500 mils of LR, immediately transport to a trauma center and establish the IV amount.
Trauma center?
Yeah.
Trauma center.
Establish the IV en route. 78-year-old female fell 12 hours ago. Now she complains of 10 out of 10 hip and groin pain during movement. Vitals are BP 90 over 50, pulse 132. What should you administer? Saline, an NSAID, ketamine, or Versed? What's the problem with this patient? Pain? Which of those is pain?
Ketamine.
That's a dumb question. A 23-year-old male was skateboarding down a ramp when he flipped over and landed on his head. He is clenching his jaw and you are unable to insert an oral airway. He thrashes his head when you attempt to provide medium ventilations. His oxygen saturation is decreasing and his EtCO2 is increasing. What is the best option to secure his airway and provide effective ventilations? So supraglottic, video laryngoscopy, nasal airway, or pharmacologically assisted intubation? Pharmacologically assisted intubation. Yeah, if he's clenching and flailing, he needs to be put
Yeah.
down, boy.
Put down.
What is a sign of brainstem herniation? Tachycardia, pupils equal round and reactive, decerebrate posturing, or hypotension?
Cerebral.
You'll at least get a 50.
Hell yeah.
Alright, that's all I got.